Good evening, ladies and gentlemen. Welcome to Triple N Media. This is a special presentation on COVID 19 world news. In this presentation, we're going to focus on returning to work. How safe are you to return to work? Is your employer ready to take you back? What about your co-workers? What do you mean, what about your co-workers? What are you talking about? Well, are your co-workers ready to take you back? Are you safe among your co-workers? Or are you a threat to your co-workers? What you need to know before you return to work. So let us explore further in a scientific manner and try to understand how important it is for us to know certain things before we return to work. There are two basic questions we need to ask ourselves, each one of us, when we are ready to return to work. How likely that you are not going to get infected at the workplace? How likely is that you are not going to infect someone at the workplace? These are pertinent questions. Let us see if we can find answers to these two important questions. Before we answer that question, first I want to ask you, which group do you belong to? There are people who had no symptoms, no tests. We don't know if they had infection. There are people who had positive coronavirus tests. They have recovered from the quarantine and they are 3 to 4 weeks into the recovery phase. Then we have people who had positive tests and no symptoms. What do we do with them? Then we have people in between. Again, what do you mean by in between? Well, I'm going to explain to you as we go further. You see, we have done more than 3 million coronavirus tests in this country. That's the largest number in the world, but that only comprises less than 1% of the US population. So if millions of people are returning to work, there has to be a better way to see how well we can protect the employee who is coming to work and also protect the rest of the workers from being exposed to the coronavirus. In order to understand that, we're going to go back to the laboratory. Here is a scientific illustrative graph showing when you are exposed to the coronavirus, it takes approximately 1 to 2 weeks to develop symptoms. And during this time, you may have no symptoms. And it is during this time you are shedding the virus, and this is the time when your coronavirus test is going to be positive. While your body is spreading the coronavirus, at the same time your body is producing antibodies against the virus. There are two main kinds of antibodies, namely the IgM, which is the immediate response antibody. It is non-specific, but nonetheless it fights against the virus. Then we have the long-term antibody known as the IgG, which the body specifically produces to counteract the COVID-19 virus. As we can see, the IgM, the immediate non-specific antibody, begins to rise by the end of first week, and it continues to rise, and it may last for anywhere from 2 to 3 months. Whereas the long-term antibody, namely the IgG, begins around the second week, and it continues to peak, and it may last for several months. Keeping these things in mind, first, you're infected. Second, you have an asymptomatic period. Then you begin to develop symptoms. And at the same time, the body begins to fight the virus by producing immediate non-specific antibodies followed by a more definitive IgG, the long-term antibodies against the COVID-19 viral infection. That is the natural course of how body tries to defend itself against an enemy. There are numerous tests available today to detect the coronavirus in a patient. And this is based on the RNA, that is the architecture of the coronavirus. And as I said, there are numerous companies which are making tests to detect the COVID-19 virus. During the first week, 67% of the people show evidence of a virus, and during the second week, almost 50% of the patients will show evidence of this COVID-19 virus. However, almost half the people may have virus beyond 15 days up to 39 days. So this is the test that detects whether you have virus or not. And even there, we have what is called false negative. That means you could have the virus and the test may come back as negative. On the other hand, you may not have the virus and the test may come back as positive. So these are all extremely low numbers. So for the time being, let's leave this aside. Now let's look at the antibodies, which I mentioned to you in the previous slide. The IgM, which is the immediate response antibody, the body starts producing that in the first week. 29% of the people in the first week after exposure to COVID-19 virus have IgM antibodies. Only about 20% of them show evidence of IgG. But by 2 weeks, 75% of the people have developed IgM and 50% of the people develop IgG. So by the end of second and third week, 94% of the people would have IgM antibodies to the COVID virus and IgG antibodies, which is detected in approximately 80% of the patients. We need to keep in mind no test is 100%, but this is all we have and we have to work with what we have. Okay, let's proceed now. Keeping this graph which I showed you in just a minute ago, and keeping those two tests we have, namely the RT-qPCR test, that's based on the RNA architecture of the COVID-19 virus. Then we have these antibodies. Now look at the various groups the people can belong to. First I had like 4 groups. Now we got more than 4 groups. Let's try to understand and analyze this. If you have a virus positive and if your antibodies are negative, that means you may be in the period of early exposure to the virus, somewhere around here. On the other hand, if you have the viral test positive and the IgM positive, that means you are in this window following the exposure to the virus. If your body has the viral test positive and both the IgG and IgM positive, that means you are somewhere along here in the acute phase of the COVID infection. If your virus test is negative and if your IgM is positive, that means you could be in the early stages of this viral infection. Whereas if your viral test is negative and the IgM is negative and the IgG is positive, if you are somewhere here, which simply says you had exposure to the COVID-19 virus in the past and you have recovered because you don't have a virus anymore in your system. Similarly, if you have a negative virus test, you have a positive IgM and IgG, that means positive IgM and IgG, that means you are in the late recovery phase of the COVID virus infection. This is sort of a long, complicated explanation as to where we stand, but when we get these tests, it helps us to understand better who is at the most risk of spreading the infection and who is at the least risk of getting the infection. For example, if you take this first group, which the virus is positive, the antibodies have not yet developed, this is the group which is most likely to spread the viral infection. Whereas if you take the last group, where the viral test is negative and both the antibodies are present in the body, that means this patient is in the late recovery phase, late stages of COVID-19 infection, and they are least likely to spread the infection or least likely to get an infection at the workplace. I don't know if we can scientifically test 300 million people to see what category they fall into and then decide whether they can return to work or not. We may have to resort to simpler mechanisms of screening people. When we are talking about people returning to work, we must understand that we already have hundreds of thousands of people who are already working in the grocery stores, in the drugstores, and in the transportation industry, and in the warehouses for online retailers. So there are people already working. That means we already have an established body of evidence that if we follow certain steps, we should be able to minimize the spread of the COVID-19 infection at the workplace. Let us look at ways in which we can protect ourselves at the workplace, as we have done for the last month or so, staying at home. If we follow some of those principles, we should be able to help ourselves from getting infected or prevent others from getting infected in case we are carrying the virus and we don't know we are carrying it. All right, now this is a diagram showing how likely you are to catch a virus from a person actively spreading the virus. If the person coughs, it doesn't matter even if you are at 6 feet, still you are going to be exposed to a high dose of the virus load if both of you are not wearing masks. If you are wearing masks, it's still going to be high, but not as much as it would if both of you are not wearing masks. Again, keeping the distance is an important factor. Now let's talk about if both people are wearing masks, that means the chances of getting this virus get into your body is much lower compared to if you're not wearing a mask. All right, now here are some tips at workplaces. And I was talking to a person who works at a large retail store. I don't want to get any names. They said every employee is asked the same questions every morning and their temperatures are checked. And if they pass that test, then they can go to their department. That's one way to check and make sure that we catch people before they have a chance to spread the virus to other people. Some of the things that we can do at workplaces, which doesn't take a whole lot of time from your work, even if it takes time, it's still worth it. That is, check the body temperatures. Wear masks, especially at workplaces when you're interacting with people coming from outside. Keep social distance as we have been doing. Wash your hands. Avoid group lunches and plastic walls between the people serving behind the counters and the customers. So these are some of the tips that we can continue to use until the COVID-19 virus runs its course and the number of active cases drops to a negligible level, when we can ease off with some of these precautionary measures we have been talking about. So ladies and gentlemen, this is just to educate you and to inform you about the seriousness of this COVID-19 virus as we begin to return to workplaces to make sure that, one, we are not getting infected from our co-workers, or we are not accidentally spreading the virus to our co-workers. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel and watch a number of videos we have on COVID-19 pandemic 2020. I am Dr. Nik Nikam.